By now, we are aware that 1 in 5,000 girl child born anywhere in the world could be having an entity called as MRKH syndrome. Yes, you heard right. MRKH, Mayer-Rokitansky-Kuster-Hauser syndrome. The syndrome being given under the name of four scientists Mayer-Rokitansky-Kuster-Hauser is about Mullerian agenesis or absence of Mullerian structure. That means a girl is born without uterus and without vagina. She is a young girl, cries in the beginning, smiles later, and then laughs and grows into a girl child given her name. And as he passes from toddler years into childhood and then into adolescence, parents wake up to a new understanding altogether that this girl child may not be normal. At the age of 12, 14, 16, 18 years, she does not menstruate. Anxious enough, they go to a gynecologist anywhere in the world. And what happens? A sonography or a dedicated investigation called an MRI of the pelvis picks up that there is no uterus and obviously no vagina. But she has got ovaries. She looks beautiful than any other girl in the world. In other words, she has got all the hormones to give her a secondary sexual characters. She looks like any other young girl. But the problem here is she does not have menstrual periods. In other words, she may not be a complete woman, and as she matures into her 20s and beyond, she may not be able to partner a male. In other words, she is born with a deficiency and a disability, which is called as absence of vital organs called uterus and vagina. So, in other words, she is not into any kind of life-threatening situation. But what she goes through is an agony all her life till somebody picks her up and probably helps her with a life-transforming therapy and a treatment. Friends, MRKH syndrome has been labeled as a rare disease. On the last day of February, we celebrate the Rare Disease Day. But this is not so rare. 1 in 5,000 individuals in gynecological textbooks, in medical textbooks, all over is mentioned as MRKH syndrome. That means if you just turn around and look at 5,000 women, one of them could be born without a uterus and vagina and could be born in any strata of life, any country, anywhere, and they miss this out entity completely. Is there a possibility of an awareness on this entity which is missed out by so many who live in agony? I, as a urologist, as a reconstructive urologist at the Kokilaben Dhirubhai Ambani Hospital for the last 17 years, having operated few every year in the era with open surgery and now robotically, do a robotic intestinal sigmoid or ileal vaginoplasty. That means we create a new organ called vagina in a reconstructive format, that having been doing this for the last 17 years in girls who from the age of 12, 14 years to the age of 27, 30 years have visited out of an awareness drive that we create on the YouTube in my name. And also today, having seen 3 patients in the last week with MRKH syndrome in the heart of Mumbai, it probably grows that we need to probably have an awareness on this entire subject. The subject has been missed out in public domain out of shame, out of agony. Parents don't know whom to go to and what to do. And sometimes some attempts have been made to correct, which has actually already defaulted. So friends, MRKH syndrome is correctable to an extent where the girl becomes complete from an incomplete situation. She could be completed by a robotic sigmoid vaginoplasty without major scars on her abdomen. With a robotic minimal surgical approach, we enter the abdomen, we create a vagina from a tubular structure called the intestines, and we place it down in the region between the motion passage below and the urinary passage, the urethra and the bladder in front. A passage is created out there where a vagina, a new organ, is seated as an adult organ. A 6 inches vagina from the intestines over its blood supply is then surmounted out there in a situation from where the vagina could be calibrated, could be dilated, could be taken care of in that adolescence and adult age group where a girl was always incomplete. I've been blessed with this month after month, year after year by women coming in and saying that my child is born without a uterus and vagina. What do we do next? And I said, she's as good as anybody else in the world. She's no less and no inferior. She just deserves a hand holding towards a journey from incomplete to complete. So it doesn't matter if she was born with a disability and deficiency. This is a correctable feature. In an era that we used to open up and do an open sigmoid and an open ileal vaginoplasty, the era has completely changed altogether. So in cases of vaginal atresia, in cases of vaginal agenesis, that means absence of vagina, a new vagina is created from intestines. And this new vagina fulfills all the requirements and thus abolishes the entity called as MRKH syndrome from the mind completely. Where somebody is going through agony of why me and how do I come out of this entrapment? that I am involved in gender reaffirmation surgery over the last 16 and a half years. I'm keen that miss outs into this entity of cisgenders, where girls are born without a uterus and a vagina, don't require a uterine transplant. A uterine transplant would mean that somebody live related will have to give a uterus, and the uterus will then have to be surmounted with immunosuppressive drugs, and later on the uterus has to be removed after the child is born with an IVF and with a surrogacy picture kind of thing around, which is perhaps not so easy. It isn't an easy entity to retain, maintain, or get operated twice and then undergo a cesarean section too. Compared to that, vagina created out of intestines makes her a complete woman. There are men who have said that, is this woman you created looks exactly like what I have known women do. That means the vagina, given the sensations of the external part, the depth, and the kind of rugosity and the kind of mucosal aspects, actually matches very closely to a vagina, and therefore this is a neo vagina. A neo vagina created helps an MRKH girl to come out of the entrapment of being an incomplete woman. She can then be a surrogate mother by a surrogate pregnancy through an IVF into another individual, and that's how surrogacy helps these individuals to be partners on one side and to be a parent on the other side. So I think today, with the kind of technology, kind of advances, kind of thought processes, and the kind of minimally invasive surgery, this has been taken up high enough. I'm happy to lead this subject and probably help individuals to be taking up this subject at the same time, being able to help MRKH individuals across the country and the world over the last 17 years. That I've seen 3 patients in the last week, it probably made me wake up again and again that if there are so many individuals who don't know where to go to, I must speak on a public platform like the YouTube channel I run, and probably this public platform where more and more people at least know that this is a correctable entity. A correctable entity is corrected by a reconstructive surgery, and that reconstruction probably brings them back to life. Of those women in the early days who got married, and we feel blessed on both sides that these women could actually get into completeness. It's an organ being created, an organ being given, an organ which lasts a lifetime and is a functional and anatomical organ out of your own body. And that's how MRKH syndrome is completely toppled over. In other words, more and more women could be born with this as a result of an entity which is an absence of an organ when they are born from heaven. But doesn't make a difference now when they are born and going to do well, because it's not a life-threatening entity. You only got to do better and better. So we need to have a heart, we need to have that strength to come over, to own up that I have an MRKH syndrome in my family, in my relation, in my neighborhood, and she needs a correction in time. I know at least 2 women, one is 49 and one is 53. Both have MRKH syndrome, and it was too late for them because they never knew this is correctable or taken to a level where reconstruction could give them a partnership and a completeness. So friends, this is an awareness attempt. This attempt probably needs to be reaching all women in the world. Any and everybody born with MRKH syndrome anywhere in the world is correctable today. And the correction not necessarily always requires an open surgery, where they can partner a male, they can probably be a mother through a surrogacy, they can lead a life completely out of mental entrapment and out of physical entrapment. Gone are the days where MRKH syndrome was probably cursed and probably looked at other way. I think in this era, in 2025 onwards, this awareness drive should go on to all women in the world that MRKH syndrome probably is an entity which can be defeated, and defeated probably by your efforts. At the Kokila in Dhirubhai Ambani Hospital, with the robotic approach that we've adopted, month after month, year after year, we're able to change lives and probably be blessed by the kind of work that we are able to do. Thank you so much for listening to this, and thank you so much for the faith in the system. Thank you again.